This was a topic that I agreed to talk about a year ago when Roseanne asked me, and then a little bit more recently than that, like several weeks ago perhaps, I sat down and actually started to research it, and I tried to make it as scholarly as I could, but truly there is not much scholarship in the medical literature about these difficult conversations. There's a ton in the business and management field, and so I've borrowed a lot from that. So the topic that I was asked to talk about in difficult feedback, difficult conversations is kind of the personal issues that we often have to talk about. So what I'm going to do is I'm going to share some examples, and I'm sure that you all should be, if you're not already, thinking about the challenges that you've had in your own professional and personal life, about what makes these conversations particularly difficult, to talk about some principles of effective communication during difficult situations or conflict, to review some of the skills that we use all the time in terms of giving feedback and giving bad news, and then perhaps at the end, if we have time, to stretch a little bit to try some new skills. So before I do that, I'm going to talk about a little Buddhism. Right speech, deep listening, and mindfulness. So right speech, according to the Buddhists, they talk about what is worth saying. And one of the definitions in Buddhist thinking of communication is a way to further our understanding of ourselves and others, and as a way to develop insight. The Buddhists say that no untruths are to be spoken, even if they're agreeable. We think of all the compliments that we give, or the top of the bread in a feedback sandwich. And not all truths should be spoken. Truths should only be spoken if they're beneficial. And truths that are beneficial should be spoken at the right time. Words that are true and beneficial, but as one Buddhist teacher says, unendearing and disagreeable to others, the topic of this talk, you need to have a sense of the proper time for saying them. Another piece of right speech from Thich Nhat Hanh, who is a fabulous Buddhist teacher, our way of speaking should not cause unnecessary suffering. The truth has to be presented in ways that others can accept. Before you speak, understand the person you are speaking to. Consider each word carefully before you say anything. And this is sort of the theme of the talk that I'm going to give. And I promise not much more on Buddhism. Right speech requires deep listening. If we cannot listen mindfully, no matter what we say, it will not be mindful, because we'll be speaking only our own ideas and not in response to the other person. And mindfulness includes mindfulness of what's going on inside ourselves. If we aren't paying attention to our own emotions and taking care of ourselves, tension and suffering build up, and then we explode. And I don't know if any of you have had that experience, but I certainly have. So speaking of explosion, what are some of these difficult issues that Roseanne asked me to talk about? They include things like personal appearance, dress, hair, and so-called decoration. Personal hygiene issues, and then various aspects of behavior. So I hope that you're all thinking about these situations. We're going to talk about how to talk about these uncomfortable issues, but let's start with some of the situations that we all find challenging, starting with personal appearance and personal hygiene. This is a quote from Hippocrates: "Doctors should be clean in person, well-dressed, and anointed with sweet-smelling unguents." Or unguents, I'm not sure how one pronounces that. I think unguents. This is a worthy goal. However, we know that people sometimes dress inappropriately and unprofessionally for work. Revealing cleavage does not belong in the workplace. Personal hygiene is sometimes unacceptable. Flirtatious behavior can lead to sexual harassment, and vulgar language is unprofessional. And here are some examples of our colleagues, at least as can be found on the internet. I freely borrowed these photos. They're not really my colleagues. Dressed in ways that might require some intervention on our part. So if you don't have an image like this in mind, keep it in mind as we talk about these. How many of you have had a situation, just by show of hands, in which you have needed to give feedback to, or wanted to give feedback to someone about these issues? How many of you have actually given the feedback? Okay. Fabulous, good. So please, this can be very interactive. I've prepared it as a PowerPoint, but please feel free to to speak up if you have some issues to share. So what is professional attire? So in my mind, I actually found this picture on the internet. I love this. So in my mind, probably the major criteria for professional attire is that our appearance should not distract the patient or family from their own issues. And anything that you're wearing or any way that you look that draws attention to yourself is probably not okay. And you should not ever have a child drawing a picture of you, of him or herself as scared and distracted because of what you're wearing. Do not wear a scary corset to work. So what about the white coat? Is that Obama? Right? So I just found this on the internet. I can't get it high enough resolution to see what the name embroidery is. But so the traditional white coat, these are also our colleagues to some extent. So in an effort, I know this is going a little bit far afield, but in an effort to be scholarly, I had to review some literature. So here it is. And you may know this already, but I learned it for the first time. So here are just 3 studies. I did not do an exhaustive review of professional attire and patient preferences. But these are 3 studies. One, in the waiting room of an internal medicine in clinic at the VA, mean age of the patients 52, a survey. The white coat was heavily preferred by these individuals who said that trust and confidence by report was significantly associated with professional dress. They were more willing to discuss social, sexual, and psychological problems with someone they felt was dressed professionally, which meant a white coat. However, in a pediatric office visit interviewing adolescents, 43% said it made no difference, only 26% wanted a white coat, and 10% said a jeans and shirt was the way that they wanted their physicians to be dressed. And in an OBGYN resident clinic, 60% of the patients, so these would be young women presenting for generally prenatal care or postnatal care, 60% reported no preference for the white coat, 63% reported that clothing made absolutely no difference in terms of their comfort or confidence. However, when they were shown pictures of different images, their reported comfort and confidence was highest in response to the image of a person in white coat, and interestingly, scrubs underneath, because this was a group that was probably going at some point to the delivery room. So there was some preference. So I think a very global, probably somewhat superficial summary of this literature is that patients care about physicians' appearance, that trust and confidence, at least in some studies, is associated with attire, and there is a higher association with the age of the patient. And it may be a generational thing. It may be that as these teenagers get older, they will start to prefer white coats, or it may be that we now have a generation of patients who will really not care as time goes on. So I'm going to, one more slide, I promise, only one more on the white coat. I just love this. So the white coat, it turns out, is declining in popularity. There was a study in 1991 that said that 70%, more than 70% of physicians wore their white coats more than 75% of the time. In 2004, a completely different study, so the populations are different, only 13% wore the white coats a significant amount of the time, and the percentage was lowest among people who worked in pediatrics and psychiatry. There's an interesting study of the weight of coats as physicians get older, and as you might imagine, they get lighter because the stuff that you carry around goes into your head and can come out of your pockets. People who wear white coats state that it's really being recognized as a physician. That's the primary reason for wearing them. Some people cite patient preference, although as we've seen, that's not necessarily a good reason, or may be becoming less of a good reason. People definitely cite pockets, hence the weight of the coat issue, and to keep their clothes clean. People who are against wearing white coats, who don't, say that it interferes with the doctor-patient relationship, and certainly in pediatrics and psychiatry that might be true, and they cite discomfort. And they also cite infection risk. So what do we know about this? We have many, many studies that have shown that white coats are a delightful breeding ground for bacteria. Staph aureus has been cultured from 25% of white coats in one study. But there is really no evidence that contamination leads to an increased risk of hospital-acquired infections. And if you don't wear a white coat and you hang your stethoscope around your neck, I'm sure that those stethoscopes become full of the same bacteria that are on the white coats. White coats, interestingly, this is stuff that actually has been studied. It's amazing if you look at this literature. The bacterial contamination of the white coats reaches a steady state within a week. So if you wear your white coat beyond a week without washing it, you're actually not at increased risk. Don't do that. And in the UK, has anybody heard of bare below the elbows? So bare below the elbows was introduced in 2007 by the UK Health Secretary. Absolutely, bare elbows, which has created some problems, which I'll talk about in a little while. No wristwatches and no ties, interestingly. So what about ties? Ties are also a breeding ground for bacteria. How many? You can lie if you want to. How many of the people wearing ties in this room have washed their ties within the last week? How many of you? How many of you have washed your ties within the last month? How many of you have washed your ties within the last year? Right? People just don't wash their ties, and yet they kind of hang over. I mean, I don't mean to embarrass you. People do not wash their ties. Maybe dry clean once in a while if you get a big spot on them, but. And you might say, well, what about a bow tie, right? Why not wear a bow tie? Because then it doesn't drip into the patient area. It turns out that somebody has actually studied this, and there is no difference between the contamination of bow ties and neckties in terms of bacterial growth. But again, despite contamination, there is no evidence that supports an increased risk of hospital-acquired infection. So what is a reasonable image and appearance policy? And you want to think about this before you talk to this resident or this colleague who is dressed unprofessionally, so-called. These are quotes from the CHP image and appearance policy, talking about presenting a consistent professional appearance, meeting infection control safety and regulatory standards, of which we've already said there really is not very much evidence, although healthcare provider safety in terms of not wearing open-toed shoes or heels, et cetera, probably makes some sense. And the one that I think is most sensible, which is ensuring that the focus remains on patients and families and does not draw unnecessary attention to the wearer. Interestingly, despite this fairly sensible policy, the CHP image and appearance policy is 10 pages long, and it includes pictures of do's and don'ts. It's hilarious. Business attire in which I am not ever dressed, according to those photos. So anyway, this allows for some individual choice, but there's still a lot of room for interpretation of what's a violation. And I just want to keep that in mind as we talk about giving feedback about these issues. What about personal hygiene? If you have spinach in your teeth, or if your zipper is down, or if you are having a particularly smelly day, do you want to know? Do you want somebody? I mean, I would want to know. I would want somebody to take me aside and tell me about this big green thing in my teeth. Not that that ever happens. We want to be obviously careful about cultural sensitivity. There are issues related to cooking, bathing, and grooming folks from other cultures, and this is something we want to be sensitive to. But I think the imperative to let someone know that he or she is not either dressed or appearing in a way that is appropriate for the workplace, whatever that means, is important. And then there are behavioral issues, right? So these may be very delicate, but they can be amenable to intervention. So personal problems, burnout, depression. Has anybody had an interaction with a resident, a trainee, a colleague in which these have been issues, right? These are things that need to be talked about, but they can be very delicate. So we're going to talk about those as well. And then there are other challenging behaviors that may have more to do with personality and may be very difficult to change, but people who are, in the medical world being shy and unassertive may make things very difficult in terms of standing up to say what you think a patient needs. People who are overbearing, manipulative, overeager, anxious. I mean, we've had all of these sometimes in the same person in our program, and these are the kinds of things that I think it really behooves us to think about how to approach. So with that all as basically background to skills, these conversations are difficult because they're personal, because some truths, as the Buddhists like to say, are unendearing and disagreeable, and because we don't like conflict. And as the wonderful book, has anybody read or heard about Crucial Conversations? There are a number of these books, Difficult Conversations. There are a ton of really interesting books, mostly from the business management world, that really break down the skills into very learnable techniques. They talk about these conversations being difficult because opinions vary, stakes are high, and emotions are strong. And I would add that in our world, maybe a little bit differently than in the HR world, these conversations are difficult for all of these reasons, and because we want to maintain the relationship. Because we have something difficult to say, we want to correct the problem, but we really care about this other person, and we want to make sure that we continue to have a relationship with this person, which may be different than somebody who's called in from HR to help deal with these things. And I would submit that this is feedback, right, which is really not very much different from the feedback that we all give all the time about knowledge and skill. It just requires a dialing up of sensitivity and skill level. But we know that feedback is essential for growth, and we know that we can't rely on self-assessment, right? In virtually every domain, we know that self-assessment is not well correlated with observation, and it's most poorly correlated among those people who are the lowest performers, and interestingly, those people who are the most confident, so those cocky folks who have an inflated view of their own ability. So in issues of hygiene and appearance and behavior, the same applies. Why don't we give feedback? Why don't we give feedback, right? We don't have any time. It takes a long time. It takes away from precious teaching and clinical time. We worry that it won't help. We worry that we don't want to hurt somebody's feelings, and mostly because we don't like confrontation or conflict. How many of you enjoy confrontation and conflict? Right, nobody would admit it anyway, right? It's not socially acceptable, but it's really hard, and most of us, if we can avoid it, we like to avoid it. But these are situations, particularly if we are kind of in charge, and this is someone who reports to us and whose work we need to rely on, we really can't avoid these situations. And as Tori says, the ability to give feedback effectively is one of the defining characteristics of master teachers, and I would say that the ability to give feedback effectively about really delicate issues is even more of a way to look at people who really know what they're doing in terms of being educators and leaders. So you all know how to give feedback. Feedback is the timely sharing of observations and suggestions. It's non-judgmental, it's descriptive, it focuses on behaviors that the learner, the individual, can actually control and modify, which is why you have to be a little careful when it comes to personality, although some aspects of behavior, even related to personality, are controllable. And it provides opportunity for improvement, and I think that the skills that we use for these difficult situations is basically the same. The format is the same, the skill set is the same, it's just dialed up a little bit. So how do we give feedback? Being direct, clear communication about what needs to be improved. How many people learned about the feedback sandwich as the way to do it? Everybody. And how many people still use that as a way to give feedback? So many of us do, right? Because it's hard to jump right into what's negative. It turns out that that first piece of bread is probably more than the learner needs if you ask the learners themselves, particularly these millennial and Gen X folks that we're dealing with. They want, like, tell me what's there, and they crave feedback, right? Residents, this generation of residents, they are a black hole for feedback. You can pour as much into it as you want, and they will never get enough. And they want to be told it straight. So I like the idea of the open face feedback sandwich, where you may have a little bit of mayonnaise or something on it, just a tiny little bit of something to get into the conversation, but then you go right to what the issue is. The bottom piece of bread is really important, and I would say that bottom piece of bread is not in this, like in this cartoon, praise, but it's actually engaging the learner in conversation. It's asking, what are your thoughts, what is your perspective, and particularly around these personal issues. I think how you end the conversation, engaging the learner, is really important. So feedback has to be safe. Can you believe these pictures from the internet? Look at this. And can you believe that I'm a pediatrician and I put these pictures on a slide? So you have to make it safe. We are not in the business of public humiliation. We know that even though it might be tempting sometimes, particularly with some of these behavioral issues, it makes people angry and resentful, and they shut down, and it's just not going to be effective. And ultimately what we want is to be effective. So how do we make it safe? We make it private. We ask permission, right? Is this a good time? You may not do this around medical knowledge or skill, but around these personal issues, you want to just be sure that you're very respectful. We want to be delivering criticism effectively and maintaining the relationship. So we use no judgment, no interpretation, right? You don't have to guess why this person decided to wear that thing that shows her midriff or his midriff today, right? It's just not okay. Has anybody had to talk to a resident about midriff showing? I have. Right. Okay. You just
send them to me.
They did. Right. They send them to me too. Right. Or I actually had to go up to the floors once with a white coat to ask this person to cover up because I didn't want to send her home. Anyway, we'll talk about that. You want to ask for the person's input and perspective, and I think most importantly, you want to lead in by developing mutual goals. The person needs to understand that you really care. You want this person to be successful. You have to find some way. Now, this is not you as the head of HR. This is you as a faculty member who needs to make sure that you continue to have a relationship with this individual. So that person has to believe that you have his or her best interests at heart. Now, just a word of caution here. When you're talking about appearance and behavior, you want to be really careful about the possibility of stereotyping and at least the perception of discrimination. And these are just questions really to ask yourself or to ask others before you go into the situation. So does anybody know who Ann Hopkins is? Well, Ann Hopkins was a CPA, an accountant in the late 1980s who was at Price Waterhouse, a very powerful accounting firm. And she was denied promotion for a couple of years, and she actually sued Price Waterhouse because, and she was successful, and actually it went to the Supreme Court. She was successful because the feedback that she got was that she was aggressive, demanding, and impatient with other staff members, and that to increase the chances of promotion, she needed to walk more femininely, talk more femininely, dress more femininely, wear makeup, have her hair styled, and wear jewelry. And the Supreme Court found that this sex stereotyping was actually the basis for her not being promoted, and they said that this was being used as criteria for partnership. So she won her suit, and there's now legislation that does not allow you to base promotion decisions on appearance. And I just point this out because those are things that I hope we can all agree are not standards to which we would hold a resident or a fellow or a colleague, and yet at that time they were arbitrary standards that were apparently in place at Price Waterhouse. Another example is the bare below the elbows and Muslim women who in the healthcare community in the UK who are not permitted religiously to be bare below the elbows. And I was actually on websites, I was looking at blogs, and there's an unbelievable amount of activity even now about this issue, with some people saying that, you know, they're working here, they should do what is the cultural norm, and others saying, you know, there must be ways of getting around this. And in fact, they have disposable arm coverings that are used here. But, you know, another example of how a policy based on actually no evidence, right, because there is no evidence of increased hospital-acquired infection, actually has caused some significant distress. And then there are multiple cases of so-called effeminate behavior among male employees who may or may not be gay, and this being a cause for discrimination lawsuits. So just before we jump into saying that's not professional behavior or that's not professional appearance, like we say we know pornography when we see it, we just want to be really thoughtful about this issue. And I just like this this little slide of you know, obvious stereotyping according to gender, but also by tattoos. Look at that very professional looking guy who obviously is covered with sleeves, and we wonder about tattoos. Tattoos are not actually mentioned in the CHP image and appearance policy. So let's move on to this issue of conflict, because that's really where we're heading and what we're trying to avoid when we avoid these situations. So again, conflict occurs in situations where opinions vary and stakes are high. and also where there's no shared purpose. And part of the issue is to find some shared purpose with the other individual, find a way to reach our goals. So what I'd like to do is stop here for a moment, and I'm going to pass out a little survey and ask you all to take a few minutes. It shouldn't take more than 5 minutes or so, and just fill this out. Think about it. You don't have to write the situation at the top, but just have in mind a recent, if possible, or perhaps a not so recent but very dramatic situation of conflict. Ideally in the workplace, if you are an angel and you have never had conflict in the workplace, you can think of something at home. And then just write down fill out the bottom part in which you're asked to think about in that situation how you predominantly responded. And when you're done, on the back, it flips over to the back, there is a little way of factoring it, and I'll tell you about that. So we'll just take a few minutes to do that, if that's okay. So I just thank you for doing this. I thought it would be useful. Has anybody taken a conflict tool, done a conflict tool like this before? So this is actually, some have. So this is actually from the UPMC HR booklet. It's adapted from a very widely used tool that I'll tell you about in a minute, the Thomas and Killian conflict tool. So box number 1, the one farthest to the left, that is so what you want to do is you want to look at where you scored the highest and then see what is available to you to stretch to. The first box is the competing style. Competing is moving to meet your own needs, not much listening, more of a I win, you lose kind of style. The second is the so-called accommodating style, in which you typically, or at least in this situation, yield to the needs of others. You do not express your needs or concerns. The third is avoiding, in which conflict is denied. There is limited communication, and nobody's needs are really expressed. Many of us have this as our predominant style, at least if we're being completely honest with ourselves. The fourth column is compromising. This is a situation in which you may assert your position, but you're willing to trade off, and you try to reach agreement because everybody gives something up and everybody wins something. And the last box is the collaborative style. This is a style in which you assert your own needs, you hear and respect the needs of others, but you really value the relationship. And the reason that I thought it was worth a few minutes of this exercise is that in these difficult situations, we and others typically move to the style that we're most comfortable with, and we either avoid or give in or try to reach compromise. And what we want to try to think about whenever there is a difference in perspective or opinion, particularly when we value the relationship, trying to move to a collaborative style. So the real science of this comes from Kilman and Thomas. And this is the grid that they developed that talks about these styles. So this was not the actual instrument. The actual instrument costs hundreds of dollars, and I decided, although I adore you all, that it was probably not worth giving you the full instrument for this talk. It probably would have also taken an hour. But as you can see, there are these domains moving from more passive to more assertive, and uncooperative to more cooperative, with avoiding and collaborating at the opposite ends, and compromising being somewhere in the middle. So the TKI, the Kilman-Thomas inventory, indicates your generally preferred approach to conflict resolution. There's assertiveness and cooperativeness as the two dimensions, and there are pros and cons to various approaches. The major con to collaborating is that it takes a lot of time, and it requires a lot of dialogue. But for some of these situations, particularly around behavior, this is probably where you want to go. For appearance, it may not be that much of an issue. You're just going to tell the person, this is not okay. But around issues of behavior where you need to be engaged with this person long term, it may be important to move there. So again, competing is winning, accommodating and avoiding, you keep the peace, but you also keep silent about your own needs and you avoid conflict. In compromising, you keep the peace and you seek balance in conflict. And in collaborating, you really value the relationship, you stay open, you stay engaged, and you really are seeking to go beyond conflict to help both sides. So, what are some guidelines for difficult conversations? First, like in any feedback situation, but probably more important or most important when you have these very delicate issues, you need to prepare. You need to think about what you want. What do you want for yourself? You want this person to dress differently. You want this person to shower more often. You want this person to perhaps cover up his or her tattoos. You want this person also to be successful. What do you want for that, for the other? And what do you want for the relationship? How important is it to you to maintain this relationship? You want to share your goal. You want to be direct and clear. Think about that first slice of bread being relatively thin or gone altogether. You want to make sure that your shared goal is genuine. You have to be honest about this, and you want to get to the point and tell the truth fast. There's nothing to be said for veiled attempts to sneak in vague feedback. You don't have to be honest about this, but if you want to, you can. How many of you occasionally in your personal relationships sneak in vague feedback, veiled as, we're just often not, right? That is a really annoying habit. I am not going to talk to you directly about that. I am simply going to be somewhat sarcastic and slip it in by the side. I've never done that, but perhaps you have. Make it safe. We talked about making it safe. If people feel safe in a conversation, they can say anything. If they don't feel safe, they will shut down or they will move quickly to competing. And that's how you know in a conversation that people don't feel safe, when they start to do that. And you need to keep noticing. In the conversation, in the midst of the conversation, you need to be vigilant about your own responses and about the other person's responses, because moving to an avoiding style to silence, or moving to a competing style to forcing meaning down the other person's throat is an indication that people don't feel safe. If there is misunderstanding in the course of the conversation, you have to notice that and move quickly to correct it. You may even want to apologize for misspeaking or clarifying at least what your position is. I talk about being confident and humble at the same time. You need to be confident that what you have to say matters, and you need to say it to the other person. The other person needs you to say it. But you also need to be humble, and that means open to other perspectives. That humility that you take into conversations is a huge factor in being safe. And if they get upset, right, people get upset in these conversations. When you're giving feedback like this, think about the feedback you give about skill or knowledge. People get upset about that. Imagine how upset, right, people get about these kinds of conversations, because this is personal stuff. It's okay to get upset. You want to acknowledge it, but you don't want to minimize it or jump quickly to reassuring the other person. And then you need to give the person time to think about it and respond. That's the bottom piece of bread. And you want to be mindfully listening so that you can hear opportunities for joint problem solving, because very often the other person's perspective is going to help you get where you need to go. So this is a matter of, I don't know how many of you feel comfortable doing this, but how many of you had a high-ish score, maybe not the highest score, but a high-ish score in avoiding. Right. So avoiding in these situations stems from fear of conflict, and from some notion that we're being compassionate by not addressing these issues. And I would submit that this is misapplied compassion. It's not compassionate to avoid talking to someone about this. The longer you go without saying something, the greater the pain when the message is delivered. Maybe you have had the experience of having something between your teeth, perhaps once you've eaten salad, and you know it's been there for a while, and finally somebody says something to you, and you say, oh my God, how many people have looked at me with this green thing between my teeth, right? So that's a minor example of something like this. It requires honesty, courage, and humility. And you may want to try, this is what I sort of like as the first piece of bread, or the mayonnaise or whatever on the top of the sandwich. Something like, I don't want to hurt your feelings, but I do want to share something that I think you might find helpful. Or I'm a little reluctant to bring this up because it's personal, but this problem is interfering with your effectiveness. So very clear, there's a problem, and I'm going to talk to you about it. Yeah, I think the more flagrant the problem, and the clearer it is that this is truly a violation, the easier it is. Although it's still a little delicate, right? Because we care about the relationship. Right.
But I don't think it's necessarily
Easier, right? But I think these same rules apply. I mean, clearly, if there's no room for opinion, that's that's much clearer. But the whole reason I did that lead-in with other standards and white coats, et cetera, is that sometimes these standards are somewhat arbitrary, and at least you want to think about that and acknowledge that the other person has a perspective that you might learn from. But even in a situation where it's flagrant and you have to enforce it, you have to make it safe, and you have to make sure the other person knows that you are there for their good. And